Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Difficulties in Emotion Regulation Scale assesses multiple dimensions of emotion regulation capacity. It measures an individual's ability to observe, understand, and manage emotional responses effectively. This instrument evaluates 6 core domains, including non-acceptance of emotional responses, difficulties engaging in goal-directed behavior when distressed, impulse control difficulties, lack of emotional awareness, limited access to emotion regulation strategies, and lack of emotional clarity. The main purpose of the scale is to identify deficits in emotion regulation that may contribute to various psychological disorders such as borderline personality disorder, depression, and anxiety. It is widely used in both clinical and research settings to guide treatment planning and to monitor therapeutic outcomes related to emotional dysregulation. The Difficulties in Emotion Regulation Scale is indicated for patients exhibiting deficits in emotional regulation, particularly those with mood disorders, anxiety disorders, borderline personality disorder, and post-traumatic stress disorder. It is most useful in clinical settings focused on psychological assessment and treatment planning, where emotional dysregulation contributes to symptom severity or functional impairment. The scale assists in identifying specific emotion regulation challenges, such as impulse control difficulties and lack of emotional clarity, which inform personalized therapeutic interventions. Research supports its application across diverse clinical populations, including adolescents and adults undergoing psychotherapy, with validity established in both outpatient and inpatient contexts. The Difficulties in Emotion Regulation Scale consists of 36 items designed to assess various aspects of emotion regulation difficulties. Each item is presented as a statement reflecting emotional experiences and regulation strategies. Respondents rate their agreement using a 5-point Likert scale ranging from 1 to 5, where 1 indicates almost never and 5 indicates almost always. The scale covers 6 domains: non-acceptance of emotional responses, difficulties engaging in goal-directed behavior, impulse control difficulties, lack of emotional awareness, limited access to emotion regulation strategies, and lack of emotional clarity. To administer, instruct the individual to read each statement carefully and select the response that best describes their typical experience. Scores for each subscale are computed by summing corresponding items, and a total score is calculated by aggregating all item scores. Higher scores indicate greater difficulties in emotion regulation. Interpretation involves comparing scores to normative data, where average total scores typically range between 70 and 110 in community samples. Subscale scores are examined to identify specific areas of difficulty. Scores above 1 standard deviation from the mean suggest clinically significant emotion regulation problems and may warrant further assessment or intervention. Sensitivity refers to the ability of the difficulties in emotion. Regulation scale to correctly identify individuals who have emotion regulation deficits. Specificity indicates the scale's capacity to correctly exclude those without such difficulties. Empirical studies examining the Difficulties in Emotion Regulation Scale report sensitivity values ranging from 0.70 to 0.85, depending on the clinical population assessed. Specificity values generally range from 0.60 to 0.80. For example, in a sample of adults with borderline personality disorder, a sensitivity of 0.80 was observed, indicating that 80% of individuals with emotion regulation problems were correctly identified by the scale. A specificity of 0.75 in the same sample means that 75% of individuals without impairments were accurately recognized as not having emotion regulation difficulties. These metrics demonstrate the scale's clinical utility in screening for emotion regulation deficits, where high sensitivity reduces false negatives and high specificity reduces false positives. The difficulties in emotion. Regulation scale was developed by Grotz and Romer in 2004 to provide a multidimensional assessment tool for emotion regulation deficits across clinical and non-clinical populations. Initial validation studies demonstrated strong internal consistency, with Cronbach's alpha coefficients exceeding 0.9 for the total scale and its subscales, supporting its reliability. Subsequent research by Newman and colleagues in 2014 confirmed the factorial validity of the scale through confirmatory factor analysis in diverse samples, including individuals with borderline personality disorder and post-traumatic stress disorder, further establishing construct validity. The scale's convergent validity has been supported by significant correlations with related measures such as anxiety, depression, and mindfulness assessments, indicating its sensitivity to emotional dysregulation. Additionally, test-retest reliability over periods ranging from 2 weeks to 1 month yielded intraclass correlation coefficients above 0.8, highlighting temporal stability. Cross-cultural adaptations and translations have also undergone rigorous psychometric evaluation, with studies in European and East Asian populations replicating the original factor structure and demonstrating comparable reliability indices. Collectively, these empirical findings underscore the difficulties in emotion regulation scale as a psychometrically sound instrument for both research and clinical settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.